Okay, so I'm going to kick off this information evening for specifically for single women on fertility. My name is Julia Paget. I'm the clinic director here at Complete Fertility, and my partner this evening is Julie Hedges, who's our donor coordinator, who will also do a little bit of the talking. Okay, so she's also going to be in the background answering your questions. So throughout, if you just want to email any questions in the question function at the side or the bottom, and she'll be tapping away, answering your queries, and then we'll have a chance for further questions at the end. All right, Julie? So we are going to kick off with introducing our slides. So let me just get that up for you. Just 1 second, I'm going to get the right display. Hang on a minute, I've lost my mouse, Okay, 1 second. Okay, so, and you're up there. Let me just, sorry, there's a few things I just need to swap around here. My screen is up there, that doesn't matter. Okay, so what I want to start with is just introducing who I am. So Julia, my name's Julia Paget. I'm the clinic director here at Complete Fertility. I've worked in various countries from New Zealand, America, and in London at a lot of IVF centres over the past 20 or more years as an embryologist mainly. But for the last 10 years, I've been here in Complete Fertility, running the operations here. But firstly, I want to reach out to you all for joining us. So this is specifically for single women that are interested in getting pregnant or have questions about their fertility in the future, how they might want to preserve their fertility. And often we do these events on site here in the clinic. And of course, now because of COVID, we're not able to do that. So we've done a few of these webinars so far. This is the first one for single ladies. Usually when we do these events on site, they're actually a really lovely, relaxed setting to do that in. And it's quite social, and it's lovely to just hear a few of your stories about what's brought you this far. And so I'm really sorry that we won't get that exchange this evening. But what I really want to acknowledge is that for you to just reach this first step of getting in touch and attending a webinar is a really big deal. And you'll all be in very different situations. Some of you might have had relationships in the past that haven't worked out, and you're thinking about what your next step might be on a journey by yourself. Others might just be looking to preserve your fertility for a future relationship. It's so complicated in this day and age of how we find the ways to make a family. And so you'll all have come on your own journey, and you'll have had possibly some sleepless nights so far thinking through how you want to proceed. And so I just want to honor the fact that you're making this first step, because that's really brave. So at Complete Fertility, we've been here at the Princess Anne Hospital in Southampton for the last 10 years. Prior to 2018, we were run and operated by the NHS hospital. Now we're still in the same NHS hospital, but we are now owned by Virtus Health Care. And I'll talk a bit more about that in a minute. I just want to run through what else we're going to cover this evening. We're going to talk about everything we do here in the Complete Fertility Centre to help you create a family, whether it's now or in the future. And then I'm going to talk about the specifics of a standard IVF or an insemination cycle, or potentially an egg freezing cycle. And then what's really common is people get stuck in the system. How do we get into the system? How do we get our first appointment? What's your next step for treatment if you're with your GP at the moment, or perhaps under NHS investigation? So we'll help you navigate that as well. And also with the new environment of COVID, what does that mean for your treatment? Because we are up and running here. We're operating our full service as before after a period of closure for a while. But there's been a number of changes to allow that to happen, and I'll talk you through that. And as I mentioned, there's lots of time for questions at the end, but do question all the way through as well. So what can we offer our fertility, our single ladies that are hoping to start a family? So of course we're going to need donor sperm. Okay, so we're going to talk about donor insemination in a little bit. But one other thing we can offer you is egg freezing. So that's preserving your fertility. It might be that you're actually not ready to start a family yet, but you're growing concerned about your biological clock that might be ticking. You might be getting a bit older. You may be having a relationship that hasn't worked out, and you're thinking, well, gosh, I really was ready to start a family, but maybe when the right person comes along, I want to be ready for that, and perhaps it's right to bank my eggs now to preserve them at the age that you're at now. But it might also be that you've got some underlying health issues that are causing you to have fertility problems anyway. So we can help you with all of those parts of the process. So for you to know, in between 2014 and 2016, treatments just for single women rose by 35%. So you can see that you're not alone. It's becoming a really common part of what we do. And at Complete Fertility, we really want to make sure that we tailor that service for you, that we don't just lump you in with everybody else that's coming through for treatment. It's a really different scenario that you're in. You're not coming in with another significant other. You're not going home with somebody afterwards that might be able to talk through your treatment. So we really want to acknowledge that you are going to need more support, and that we're here to understand that you need a bit more hand-holding through that process. And that's why we've really kind of set ourselves apart as people, as a clinic that really focus on single women specifically as a group. So, as I mentioned before, who are we? So we're a member of Virtus Health since 2018. They're the largest provider of fertility treatment in Australia and Ireland, and they've also got clinics in Denmark and Singapore, and we're their only clinic in the UK. And what that means for us is that we're able to link in with this incredible global network of embryologists and doctors. So when we want to discuss how to get better pregnancy rates or share cutting edge science, we can have a fantastic network of over 40 clinics worldwide where we can discuss best practice, and our clinicians and embryologists share information all the time in that manner. Every patient that comes through our door just wants a baby, whether it's now or in the future. That is their intention. They want a baby. They don't care about all of the fancy parts on top. They just want to have a baby. So we put that at the forefront of everything, and we want to acknowledge that every appointment you have with us, that's what you're crying out inside. You just want to have a baby. And we want to maximize your chance of achieving that. We don't just want to maximize the chance of a pregnancy. We want it to be a singleton pregnancy, because we do know, as I'm sure you're aware, that multiple pregnancies come with all sorts of risks around preterm birth, just because there's more babies in the uterus that they want to come out sooner. And when that happens, there can be all sorts of problems associated with that. So everything we do is about optimizing the achievement of a healthy singleton pregnancy. Because we're based in Southampton Hospital, we also, our medical director, Ying Chong, spends half of her time in the university. So Southampton University, the medical school there. And that means we have a lot of research projects going through our clinic all the time. And therefore, what the treatments that we offer you aren't just plucked off a shelf or because they've been written about in the Daily Mail. We want to offer you treatments that we know have been researched through peer-reviewed trials, usually randomized controlled trials, so that we know that if we're offering you some form of treatment, we know that it has been proven that it's going to enhance your chance of a pregnancy. We've also got clinics in Portsmouth and Bournemouth, as well as our main clinic in Southampton. So that's really helpful for you to know if you're living in the wider area around Hampshire, or into Dorset, or over into West Sussex for Portsmouth. So this is just a picture to show you all of our friendly doctors. Everyone in the photo here is a doctor except for me in the centre there with our medical director, Ying Chong. If you're going to our Bournemouth clinic, you may see Dr. Millie Saran there on the bottom left. And if you go to our Portsmouth clinic, you may also be seen by Dr. Nalima Dixit, who's in the middle there on the right. And all the other doctors will see you here in Southampton. All of our appointments now have moved to being remote or over Zoom. So you may see one of these people on your computer. So I'm going to talk you through how people get into the centre. So usually it can come about from a referral from the GP, especially if you live in the Hampshire area. You should be able to receive that first referral and your first appointment with us on the NHS. If you don't live in Hampshire, it may be different for your local commissioning group, and we can help you explore that. But in general, if you go to your GP, even as a single woman, and say you're really keen to have a pregnancy or preserve your fertility, you may be able to get that first appointment on the NHS. So it's worth exploring. Otherwise, if you don't want to do that, or your GP doesn't have that line, then you're able to self-refer to see us privately. And either way, you come in and you see one of our consultants here in the fertility clinic. And what's lovely about this stage is that in other areas, you might go and see a consultant in another hospital with what they call secondary care. But here in Southampton at Complete Fertility, we do the secondary care straight from the GP, as well as the next level of care, the treatment. So it means you don't get lost in the system. If you go off for tubal assessments in another hospital or blood tests elsewhere, then often it can be quite challenging for the patient to actually get to the point where they're having treatment. If you ask your GP to refer directly to Complete Fertility in Southampton or Bournemouth or Portsmouth, then we're able to manage that whole pathway for you and you won't get lost in the system. So once you come in and see one of our consultants, they'll get the whole medical history from you and find out what the best course of action for you is. They may take some further tests, a hormone level called anti-Müllerian hormone, or AMH, which tells us how many eggs or follicles your ovaries might be producing in a given month. And they might also take a scan to have a look at your ovarian function as well. And if anything flags up at that point, they may, in a few cases, request that you have some further optimization, possibly via surgery. Now, if that is the case, then once again, it's really fortunate for us here in the Princess Anne, because our doctors also work in the NHS or privately to do that surgery. And again, you won't get lost in the system. And then it's very unusual, though, that you might need surgery. Just a couple of % of patients might need that. And then you'd be ready to go on for fertility treatment, which once again happens all here in Southampton or Portsmouth or Bournemouth. So what treatments might be available to you as a single woman? Well, so we would take a full history from you, and it might be that if you've not been exposed to sperm in attempting to get pregnant recently, then it might be really appropriate for us just to use some donor sperm and inseminate it into your uterus at a prime time of the month, and when we perhaps stimulated your ovaries ever so slightly to make sure that they're producing at least 1 or 2 eggs. However, it might be the case that that's not the appropriate line of treatment for you, either due to a number of factors, but it might be you've already had some insemination treatments and you've not got pregnant, or your doctor might agree with you that actually the best course of action might be to take the eggs out and then undergo IVF or ICSI, which is when we inject the sperm directly into the eggs in the lab. Now, one of the options in this is to share half of your eggs with another woman, or and that would allow you to receive free IVF, and we'll talk to you more about that in a while, or to just have IVF with your donor sperm, or you might have egg problems yourself, and in which case we would identify that you may need donor eggs, and we have a good program for egg donation as well. And then other treatments that might be offered to you is if you've had an IVF cycle and you've frozen any spare embryos, then you might come back for what we call an FET, or a frozen embryo transfer. Or it might be that at the moment the time is just not right for you to have treatment, but you want to do something about your future to make sure that you've preserved your fertility at this point in time. For example, you're 33 years old and you're thinking, well, what if this isn't the right time in my career, or I haven't found the right person, but maybe I might want to have a pregnancy later down the line. You can freeze your eggs now after consultation with one of our doctors, and then you know that you've preserved your treatment and you've got something in the bank there. So how can we help you? What's really important here is we've got a large donor sperm bank. So we've got over 20 donors at the moment, and Julie Hedges will talk to you about that in a minute. All of those donors are screened and healthy. I know from personal experience with friends that have tried to access sperm donors by various websites, which is absolutely fine if that's the thing that you wish to proceed with. But if you are going down that avenue, you need to consider what is the health of that donor and what are the legal repercussions, because that person that's donated their sperm would be the legal father of your child. Whereas doing this via a licensed sperm bank and fertility centre such as us protects all of your legal rights around the parenting of the child through the forms that we use, so that you are the only legal parent of that child, and also ensures that sperm is screened and is not going to pass on an infectious disease, and all the appropriate consents are in place. We offer individual first-class compassionate fertility care. So we are going to talk a little bit more about what we do to look after you and the compassion we give in a while in this talk. We also offer price packages. So everything that our price list isn't confusing. It comes in little boxes and it can be shared during this talk, I think, and it's also on the website and we can send it to you as well. but all of our packages are in little boxes, so it's very clear what you're paying for. And before you start any treatment plan, you always have to do what's called a costed treatment plan, which you sign off on with a nurse, and they'll go through exactly what you're going to do in your treatment and what you might be charged for. So it's very clear upfront what you'll be paying for. We've got fantastic success rates in our clinic, and I'll talk about that later on. We also offer single ladies what we call a fertility MOT, where you can come in and just have an assessment. You might not be interested in having a baby at all right now or freezing your eggs, but just come on in, meet one of our consultants and get those baseline tests done so that we can give you an assessment of when we think you really do need to be having a baby by to not be affected by what happens to all of us with biology over time. We've also got a fantastic counselling program as well, which I'll talk you through in a bit. So I'm going to hand over to Julie here, and she's going to talk through the donation part, and I'll come back on in a second.
Thanks, Julia. Hi, my name's Julie Hedges. I'm the donor coordinator here at the Complete Fertility Centre. I'm going to talk to you briefly about our sperm donor and egg donor programmes. I'll start with sperm donors because for your treatment, you're going to need to think about donor sperm. So we have our own donor sperm bank here, and depending on the treatment you're having, you have a choice currently of up to 22 donors. It's important to know that we do recruit our own donors, and we have a strict criteria for all the donors before they can come through. They have to meet that, and all donors are screened in accordance with HEFA guidelines. It's about a 6 to 9 month process for a sperm donor before we can actually release the sperm for use, and for 3 months of that we actually quarantine the sperm. So after a donor is finished donating, we quarantine the sperm for 3 months. The donor then comes back for further screening before we can actually release for use. But be assured, everybody on our donor website has already been released, so the sperm that's on there is available now. So the reasons donors donate, there's lots of reasons. Sometimes it's because they have a friend or family member that have struggled with fertility, and sometimes it's just something that they've read about and they thought, oh, this would be a really nice thing to do. And they come from all walks of life. So as you will see from the slide, we've had teachers, solicitors, students, scientists, doctors. We've got a butcher, we've had a milkman. We've had lots of different donors come through, and again also different characteristics. So and that's quite important to people, so that's something you would be able to see in the donor's characteristics, and also different ethnicities. Each donor writes a little bit about themselves, so they write a goodwill message, their reasons for donating, and they write about themselves, so personal description, and again that's all information you can see. It's important also to be aware that donors are not the legal parent of any child born. And that's very clear, that they're aware of that and you're aware of that, and that's how it is. And they remain anonymous until a donor conceived child is 18. At the age of 18, that donor conceived person does have the right to ask for identifying information of the donor. And there is a 10 family rule. So in the UK, the law says that a donor can only help create up to 10 families. It could be more than one child per family, but it's 10 families that can be created. The screenshot you're seeing now is from our donor website. So what happens once you're coming through for treatment and you've had your implication counselling, you are then given access to our donor website. This is the first page you will see, so that just gives you some brief information, eye colour, hair colour, for example. And if you click on view profile, you'll then be able to read what the donor's actually written about themselves. And you can actually then choose the donor through the website. We get an email saying this person's chosen this donor, and then we then contact you to discuss further. How do you select a donor? Well, a lot of people have that in their mind already. They want somebody with a certain eye colour, certain hair colour, certain build, for example. But I quite often find that people change their minds when they actually read what the donor's written. Sometimes that's more important. They will just identify with a certain donor and will choose the donor that way. So basically, if you're coming through for treatment, you're given access to the website, and you can choose your donor from there. So we also have an egg donor program, and so we have patients that need donor eggs. And we have patients that want to donate eggs, which is great. So egg sharing is something that allows you to use half of your eggs for your own treatment and donate half your eggs. It's a really lovely thing to do. Our egg recipients, for various reasons, can't use their own eggs in treatment, so it's a really lovely thing to do. It does give them the opportunity to carry a baby. There is a criteria, as with sperm donors, quite a strict criteria. So not everybody that wants to egg share can, but we obviously can provide that information, and we also have a questionnaire. As I say, it actually means you can keep half the eggs for your treatment and you can donate half your eggs. And we greatly reduce our packages for people that are egg sharing as a thank you. And again, you can see our price list on our website. We have the last thing I'm going to say is we have a dedicated donor team, and then also a dedicated phone number. So anybody that's egg sharing, we will guide you through that process, and we are on the end of the phone at any time to be of help to you. So I'm going to hand back over to Julie, who's going to talk about egg freezing. If you've got any questions at all about egg sharing, donor sperm, please put your question through, and any I don't get to today, I will come back to you tomorrow. Thanks very much.
Great, thank you. And I'm just noticing on that slide, Julie, that we've got the old phone number, but that phone number should
phone number,
still
I was just thinking
work,
that, yeah.
But use the phone number at the bottom of the slide if you wish to contact Julie. Okay, thanks, Julie. So moving forward, that's all about using the donation, the sperm donor. But what if you want to egg freeze? So it might be for medical reasons you need to egg freeze. Sometimes it's because people are going through cancer treatment or some kind of treatment that's going to affect their eggs or ovaries in the long term. So we need to bank those eggs or embryos now. But it may, as I've just said earlier, be for social reasons, and that's absolutely fine, and we can help you discuss whether it's appropriate to do so. And you might also want to discuss whether it's right to freeze your eggs or freeze embryos, because there's some variables involved with the rates of survival for eggs versus embryos. And we would make those decisions with you. And if you were going to freeze embryos, then obviously you may need to select a sperm donor to do that. We'd help you make those decisions based on how many eggs you might be able to get in any given treatment cycle, or whether it's worth creating some embryos as well. So I'm going to talk you through what happens in a treatment cycle so that you get an understanding of what you might be going through and what we might be helping you with if you came to our clinic. So all treatment, whether you're intending to freeze your eggs or whether you're intending to have sperm put into your uterus through IUI, which is called intrauterine insemination, or here we've also got DI, which means donor insemination, it's exactly the same thing. Or if you're going to have IVF, where your eggs are taken out of your body, it starts off exactly the same, because what it starts with is we're going to try and stimulate your ovaries to produce a few eggs. Now, for insemination, we only want to produce 1 or 2 eggs, but for IVF or egg freezing, we want to produce, on average, between 8 and 10 eggs, but that might be sometimes up to 20 eggs, okay? So what it starts with is you call us on day 1 of your period, and then you come in a couple of days after that for what we call a baseline scan. And at that point, the nurses will meet with you. You'll by this point have met with a nurse that you've done your consent and preparation with. And hopefully that nurse or one of the other team, if they're off, will do the scan for you to check how everything is going. We want to see a nice quiet ovary at this point and that your uterus is looking healthy. If at this point we see anything that's not great, like a cyst or something that's not, your lining of your womb isn't looking as it should be, we might defer that treatment for another month. But in general, we start just there a couple of days after your period. And then you're told to go home and start taking the medication that you've been given during your nurse appointments. And the first medication you start taking is one that's going to start stimulating your ovaries to produce more eggs, and that's usually called Gonal F, or follicle stimulating hormone, or Menopur, a name similar to that. You start taking those medications, and then a few days after that, you introduce another medication that we call an antagonist, and that medication is designed to stop you from ovulating when we don't want you to ovulate, because we need to be able to time that ovulation very carefully, either for eggs in the lab or for the sperm insemination. So you start taking 2 doses of medicine after about day 5 or 6. And you'll continue taking both those doses of medicine for about 8 to 10 more days. And during this time, you'll come in for about 2 or 3 further scans, usually 2 or 3 days apart. And at these scans, the nurses or ultrasonographer can see how your follicles are developing and how your eggs are growing. And they'll be able to give you a guideline of perhaps how many eggs might be being produced there. It's never exact, but we can give a clear estimate of what's going on in there. And once those follicles start to get to a point where they're a good size, usually over about 17 millimeters, and we've got 1 or 2 at that size, we give you a medication that we call a trigger injection. And that injection is designed to cause ovulation of those eggs and allow them to go through the final stages of ripening to take on a sperm. Now, the timing of that injection, the trigger injection, is usually quite specific, because 36 hours later, if you're going to have an egg collection, or 38 hours later if you're going to have an insemination, we are going to be timing those procedures. Now, you've still got a good window either side of those hours time frame that we give you. So don't panic if you're late parking, or if you have any concerns getting to the clinic, or if we're running behind because we've got other patients before you. But in general, the time you might be given might be 11 o'clock at night, 12 o'clock at night, 1 in the morning, something like that. And we do need you to stick to that time so that we can manage your treatment as well as possible. And then we go through the process itself of inseminating the sperm or taking the eggs out, which I'm going to talk through further in a second when I talk about what happens in the lab. And if you've got you've had your sperm inseminated, that is the end of your treatment, and you'll then go home to wait until your pregnancy test. Or if you're having an embryo transfer, then that's usually about 5 days after your egg collection. We will then transfer the embryos back into your uterus with a very tiny piece, a very tiny catheter that looks like a piece of spaghetti. It's not really a piece of spaghetti, like I nearly said. And then what comes is what we call the 2-week wait. And I'm sure you may have seen if any of you are on any of these forums for fertility treatments, this is what patients have reported finding the most stressful and the most tense and anxiety producing part of your treatment cycle, because you're sent home or go back to work, and we are no longer managing your treatment cycle until your pregnancy test. And that can be quite distressing for you at this point, because you've been in almost daily contact with our nurses through your treatment, and then you can feel very, very alone during this period. So what we do at Complete Fertility is make sure we check in on you during that time frame and just check how you're getting on, and see if you need to talk to us about anything. We really hope after 2 weeks it's a positive pregnancy test. If it's not, then we get you back in for a review appointment and to see what we can do next time to help increase your chances. But if it is, and we hope it is, then a few weeks after that, you'll come back to us for an early pregnancy scan to confirm the viability of the pregnancy. So this is a photo just to show our lovely nursing team and our healthcare assistants. The healthcare assistants are the ladies or HCAs are the ladies that look after you during your egg collections or embryo transfers. They also do your blood tests, and right now COVID swabs and things like that. So you will have a lot to do with them during your treatment. The nurses you'll get quite attached to, because they will, once you've seen the doctor, you'll then be passed on to a nurse for your nurse consultation. And from that point, that will be your lead nurse that will hopefully take you through your treatment cycle. As I said before, some of these nurses work part-time, some people are off sick or have holidays, so you might see a different nurse occasionally. But we want you to request, if you find that you get on really well with a certain nurse, or you prefer not to see another nurse, that we don't mind. We want to hear the nurse you want to see, and we will help you arrange that, okay? We want you to find someone that you really connect with. Again, in the lab, this lovely bunch of people will be looking after your eggs and your embryos, and also preparing any sperm necessary during your treatment. And I think what's really key to Complete Fertility is that I've been part of the recruitment of every person in all of these photos, and we place huge importance not just about the fact that they've got the right expertise or the right skill set to do the job that they do, but also they've got one common thing in their personality. They're all really nice people, and we select them on the fact that they can show empathy and they understand what you're going through. That's absolutely paramount to our members of staff. We don't care if they've got all the degrees in the world. If they can't show you empathy, then that's not the right fit for our team. So I'm going to talk you through what happens in the IVF lab. So basically, the embryologists, they look after eggs, sperm and embryos while they're outside of your body. And all the time, they're trying to basically trick them into believing they're still in your body. So they use these incubators on the right there that look like sandwich toasters. They keep everything nice and warm. And they also use fluid that is based on the reproductive tract in the female, so that everything we do, we are hoping that the embryos have not worked out, that they're not in your body. We've also got an incubator in our lab called the Embryo scope, which, as you can see on the right there, the videos are moving along. It takes a photograph every 10 minutes during embryo development, which allows us to monitor any abnormalities that might occur that we wouldn't normally have seen if we just do a single spot look at your embryos. Then if you do use this incubator and you have your embryos transferred, if you do then get a pregnancy, then we give you the video of the embryo forming. So while the eggs have been collected, we also prepare the sperm. So in the case of donor sperm, it's been frozen, it's been quarantined for 6 months and had further blood tests before we're able to use it. And then we thaw it out, we prepare it, and we decide whether it's appropriate to do IVF, which is when, on the bottom left there, we put 100,000 sperm with each egg and allow them to fight their way, or one to fight their way in naturally. Or we do ICSI, which stands for intracytoplasmic sperm injection, which you can see on the right involves actually. So here on the left, you've got the egg with all of the feeder cells around it that have been supporting the egg in the ovary. For ICSI here, oh, sorry, it went forward. For ICSI here on the right, you can see that we've taken those cells off around the outside of the egg here. You can see my pointer here. And that's allowing us to move the egg around and to see what's going on. But we also see then that the egg is mature and ready to take on a sperm. And we know that by this little blob here at the top that we call the polar body. So of every 10 eggs, you might only get 7 or 8 that are at this stage of maturity, what we call an M2 or metaphase 2 egg. And so this is the reason why when people say, well, why doesn't everyone have ICSI? Because surely putting a sperm in the egg guarantees fertilization. Well, firstly, not all eggs are going to be mature enough to take on a sperm at this M2 stage of development. But with IVF, it allows the eggs to naturally take the time overnight to get to the right stage of development if they are not there already. But once you take off those feeder cells around the outside of the egg can no longer mature in the same way as with IVF. So it sort of stops the egg at that point in time. Also, by introducing the needle into the egg, it can cause damage in about less than 5% of eggs. So we don't want to do that unless we need to. Okay. But in the cases of frozen sperm and donor sperm, we do often opt for ICSI because freezing sperm can knock off the quality of the sperm in terms of motility. So it just supports that process of fertilization. Oh, now I need to, oh no, sorry. Oh gosh, hello. I'm just going to get to the video here by coming out of the presentation, sorry, if I hadn't pressed some button to make sure that didn't happen. So I'm going to play you the video from this point in the presentation. This shows the sperm here is in the microscopic needle, and it's coming down. If you follow my cursor, it's coming down to the tip of the needle, and then we push it through the egg shell and into the membrane of the egg. And now we've got to break the membrane by sucking back until it goes pop, because that membrane is not yet actually broken. So the sperm is still here, and in a minute it's going to go whoosh. There, it's gone whoosh. The sperm is now up here, and the membrane's now popped. So we're going to place very carefully the sperm back down into the egg. Down here, there's the sperm. There's the sperm there where my cursor is, and then we want this membrane to seal up behind it. So you can see how it's such a very delicate procedure. And once that sperm is in the egg, it still doesn't guarantee fertilization. About 70% of eggs will fertilize after this process, because the egg then has to do some very complicated processes to go through. So I'm just getting the presentation back up to the right view. Goodness, I'm sorry. Oh, 1 minute. Sorry. Let's just get that on the right setting. I have a feeling you can't see my screen now. Can you see my screen? Julie, can you see my screen?
Yeah,
you can. Okay, thanks, Julie. Thanks, Julie. Sorry about that. I've got too many screens here and it can be very confusing as to what's being shared. Right, so this is going to talk through what happens the day after egg collection. So what we've got here on day 1 is a fertilized embryo. It's got 2 sets of genetic information. I'm going to bring my cursor over here so you can see. One's male, one's female, but we don't know which is which. So as I said before, about 70 to 80% of your eggs will fertilize like this. Some just don't take on a sperm or don't do what they need to do once the sperm is in there. And some choose to fertilize abnormally, and we can't use those ones. And over the next couple of days, they start to divide. And after about 3 days post egg collection, they look like this, an 8-cell embryo, where each of these cells basically has the potential to become anything in the human body. So these are basically embryonic stem cells at this point. We call that a day 3 embryo. And up to this point, the egg has been in charge of these divisions. But beyond day 3, the embryonic genome switches in. And so if we can get to day 5 in the lab, then we really know which embryos are the winner embryos and the most likely to cause a pregnancy, especially if we can get to this stage, what we call the blastocyst stage, where we have a section of cells here, which we call the inner cell mass, and that's going to become the baby. And then around the outside, the trophectoderm, which is going to become the placenta. But of every 10 embryos that look like this, the cleavage stage embryos, only about 3 become a blastocyst like this. So it's allowing us to choose the best quality embryos for you to put back and the ones with the most chance of causing a pregnancy. And then, did you know we've all had to hatch out of an eggshell at one point? So here's our eggshell, and this shows an embryo hatching out of it so that it can plant in your uterus. I apologize for the mess on this slide down here with these letterings. I clearly didn't fix that earlier on today. Now this video is going to show us, again, I'm going to have a problem with the video. I'm going to just come out of it. Oh, yeah. I'm going to come out of the slide just to show you the video of this embryo. So this has been taken in our time-lapse incubator, the embryoscope. You can see there's 2 sets of genetic information here forming on day 1, and then they go away, and then we have a 2-cell embryo cleaving 2 days after egg collection, which becomes a 4-cell embryo. And you can see some little fragments that come out, which is perfectly normal along the way. And then we go to 6 to 8 cells. This is on day 3, and the egg's in charge all the way up to this point. And now the embryo genome switches in. So basically the new child's genetic information takes over from this point. It becomes a morula first. It looks a little bit like a beach ball. And then it starts to form a cavity in the middle, which starts to pump and pushes out. And as it pumps, you can see the shell on the outside starts to get thinner. Here's the inner cell mass that's going to become the baby, and down here it goes pop, and a little bit of the cells start to leak out of the eggshell there to allow for hatching, which is a really amazing process. And it looks like the embryo has to go, like one of those cartoons when it goes underneath the door through a tiny space to get to the other side. It's quite incredible to witness. Right, I'm going to put the presentation back on, and I'm sorry if it goes off my screen again. Okay, I'm going to just fix that again. I'm really sorry that this has happened. My mouse. Okay, display settings. Okay, here we go again. Right, so something we have in the lab is what's called the RI witness station. And you can see this white bench there. That's a heated stage for all of our embryos and sperm to sit on while we're working with them, but it's also reading the barcode frequency, the barcode labels that's on your samples at all times, which means that if we put Mrs. Jones together with the wrong sperm donor, then the alarms would go off in the lab. So it's a double witnessing system, which reduces the risk of error to very, very minimal levels, which is a fantastic thing to have in our lab. But the other key thing to get across is that embryologists have major OCD, obsessive compulsive disorder. We are obsessed with details because if we make a mistake, the repercussions are too large to consider. So all of our lab staff are exactly like that. They're all very, very focused on the task in hand, and they certainly wouldn't sleep at night if they thought there was any room for error. So they're all a very trustworthy, fantastic bunch. So I'm going to talk about the support mechanisms we have in place for you at Complete Fertility. We know that one size doesn't fit all, that you're not going to all want to go and see a counsellor or join a support group. So what we've tried to do at Complete Fertility is offer a range of approaches on support so that you can find the right thing for you. And it's something that we're really proud of, and we've had a lot of feedback from other settings in the HVA that we do really well is our patient support program. So firstly, we offer counselling. If you're using donor sperm, it will be obligatory that you see our counsellor anyway. But either way, seeing our counsellor is completely free of charge for up to 6 sessions with the counsellor. We're basically not going to charge you for counselling. We want you to access our counsellor. And it's really going to just help talk through what's got you to this point so far and explore all the options available to you and what the repercussions might be, especially around using donor gametes, but that you can basically use her for any concerns you're having. We've also got an app that's unique to our centre called Medi-Emo, and the emo part of that stands for emotional, because it does all the things you'd expect it to do in terms of planning your treatment cycle and telling you what medication you need to take when, but it also gives you some coping strategy techniques and some mood management information, and it's going to ask you how you're feeling on a daily basis, like to rate your anxiety levels. And the point of that is actually it's part of a research program that you, if you're okay to consent to, and that's allowing us to gather some information so that at some point in the future we'll be able to take those data that you're giving us, and if you're actually expressing that you are concerned on a higher level than usual, then that would trigger our nurses to give you a call and just check in with you. We've also got a support group. We used to have a support group here in the centre that ran monthly. Of course, that's not something we're able to offer now during the pandemic. So what we've done is we've moved that to a Facebook group called Complete Fertility Patient Support. As soon as you're registered as one of our patients, then our nurse will let you into that Facebook group if you request that. And it's moderated by one of our senior nurses, Debs McGuire, and also a counsellor, Ruth Wild. And we only launched this during the lockdown about 4 weeks ago, possibly. And to begin with, we were a bit concerned that, you know, it might not take off. And but already you can see it's a really busy place of support. People saying, I'm starting treatment now. Is anybody else in a similar boat? And then people are reaching out and saying, yes, I'm going through this as well. This is what I found helps. And our counsellor is posting some information on there as well to support you and answer your questions. So I really recommend that as a support for you. We've also got the buddy program. So it might be you don't want to talk to lots of different people, or you might not want to meet the counsellor, but perhaps you just like to be put in touch with one other person that's in a similar situation to you. So you might let us know you're interested in the buddy program, and you say, I'm a single woman that's interested in freezing my eggs. And we would try and find somebody else in a similar situation to you. And then with both of yours consent, we put you in touch and you can take it from there. You might want to meet up for a coffee, go to their house, or you might just want to have a phone call or an email. But just knowing that somebody else is in a similar situation can be really helpful for you. So how do we do in terms of success when we use donor sperm, or for insemination or when you are having an embryo transfer? So if you look, these are our results from 2016. And you can see at the time at the bottom, the national average was 12% for live birth using donor sperm for donor insemination. Now, for us, donor insemination is this bar chart here on the left. And if I take the pink bar, that is everybody's age. Okay, the blue bar is if you're 37 and under, and the grey bar is 38 and over. So if we take the pink bar, you can see that all of these are well above the national average of 12%. And the live birth one is the key comparison here, which is at roughly just under 25% there. And for donor ICSI, which is using when your eggs come out of your body and we put the sperm in, again, if you look at the pink rate here, those are just under 40% or just over 35% for positive pregnancy, and live births around 28%. Okay. So the next slide, this shows the national average from the HFEA website that's just been released recently. So the clinics rate is the orange bar here. So we're at 31% for births per treatment in 2017 for donor insemination, and the national average was 17%. And births per treatment, the one on the left is for if you're under 38. The one on the right is if you're over 38, the clinic's results were 20% and the national average was 8%. These are just some statements that the HFEA have said about us. They give us an inspection every couple of years, and all of our reports are on our website and their website for you to have a browse through. So there's some nice feedback there from the HFEA. Now, I want to talk you through what the changes have been put in place. We're nearly at the end of the talk, so don't worry. Just the changes that we put in place around COVID to make sure that the safety of our patients is paramount at all times. So we were closed for 2 months during the lockdown, but we're now back up and running. We are back performing all of our treatments as before, but all of our consultations with nurses, doctors and counsellors are continuing via Zoom or over the phone. That's worked absolutely brilliantly, so convenient for the patients, and the doctors and nurses love it because it's just so simple for everybody. That means that the footfall of our patients has massively reduced into the clinic. So there's not so many people here. And those staff that are able to work from home do work from home now. So I'm usually working from home. I've just come in today just to ensure that there's no internet issues for doing a webinar. We've got plenty of personal protective equipment for our patients and for our staff. So you will see our staff in PPE, and we will ask you to wear a mask during your appointment, and we'll give you that on arrival. And we're also testing our patients for COVID prior to any procedure. So if you're going to have a scan or treatment with us, we will do a COVID test on you. And then we'll ask you every time you come to the clinic to complete our health assessment to check that everything's okay. Once you've had that COVID test, we will ask you to basically cocoon during your treatment so that you are not putting yourself at further risk during the course of that treatment. We are no longer having a waiting room, so we'll ask you to wait in your car or outside until we're ready for you and then call you up at your specific time. We've got our social distancing policy in place, and we've got screens and guidance markers around the clinic. We're also allowing lots of additional time between our patients to make sure that we've got time for the additional cleaning and PPE that needs to be applied. And we're extending our opening hours to allow that to happen. So we really, obviously we built up a bit of a waiting list during lockdown, and we're getting through that waiting list very efficiently now. This is just a very quick, not particularly brilliant video to show the social distancing signage. Sorry, it's a swinging camera, but it just basically shows you that we've got lots of things in place to support your safety while you're in the clinic. So just in summary, why would you choose Complete Fertility? Let's get some words up here. We're passionate about supporting you along your fertility journey, and our team is very friendly. They've been picked for how nice they are, and they're really experienced and supportive. We've got clinics in Bournemouth, Southampton and Portsmouth, so do let us know which of those you prefer to be seen in for your appointments. The final stages of treatment are always in Southampton because that's where our large lab is, but for those initial appointments, they can be in Bournemouth or Portsmouth. We've got rigorously screened egg, sperm and embryo donors. I'm sorry that this picture's in the way, it wasn't when I planned it earlier. We have a free IVF for egg sharers program. We have the embryo scope available for those that wish to use it. We have a fixed price package with no hidden costs, so everything will be explained to you up front. And we can also offer you interest-free payment plans. So if you're struggling to pay for any treatment, we can offer interest-free payments over 12 months through a finance provider. We've got an active research program, and we do have a reputation for treating single women specifically, and we've got excellent success rates. Now, because you're not in the clinic this evening, as you usually would, we would normally guide you around the clinic, show you around, and have a good chat to you. So instead, I've taken some photos of the clinic just to give you a bit of a picture, a bit of a feel of what it's like here. So on the left there, you can see one of our waiting rooms. We've got 2 waiting areas. And here's just some pictures of the nice fresh corridors. It's lovely, open, airy. People come in and they always say what a nice, light, airy space it is. It has a really clean feel. This is Claire in our lab, just dealing with some donor sperm there on the left and doing an ICSI on the right. These are a couple of pictures of our consulting rooms, so you can see they're nice and large. And this is the recovery room. So when you come for an egg collection or an insemination, you'll be asked to take one of the trolleys here. They're all cordoned off by curtains, and we don't allow more than 2 people in this room now due to COVID. So we've got some extra side rooms that we can also put you in. So we've got lots of space. The Zoom appointments have really helped us free up space in the clinic, which has been fantastic. And when you have an egg collection or an insemination, then we will use this room. We call it our procedure room. You can see the bed that we use there. We use a consultant anaesthetist for any egg collections, which means that you don't remember a thing about it. And the screen up there on the right is connected to the microscope in the lab. So you can see your embryos before they're replaced. You also get given a photo of your embryos, and you can follow that process through. So we always offer something special for anyone attending an open evening. So it'll be the same for our webinar this evening. Anyone that books this evening or as a result of this open evening, if you quote that you've attended the webinar, then you can receive £100 off donor sperm, which is normally £850 for one cycle of donor sperm. So that would be £750 for you. This is some feedback from our patients, which I'll let you read. And while you're doing that, I'm going to go and see if we've got some questions, if I can work my cursor. So let's, have to get when it stops. I'm going to stop sharing. And I'm going to bring my questions down to the right screen. I'm really sorry. I've got too many screens involved here. Right. Okay, so let's find some questions. So I can see Julie's been working away in the background there, and it says she's already answered quite a few questions, but I'll talk through some as well. So the first question, if I'm in the military, how does it work? I'm in the Royal Navy. Can I get an NHS referral? Yes, the military do offer some very good packages for treatment. So it's worth exploring with your military GP how that works. So start with your military GP and ask about the referral that you can receive. And if you have any queries, you can also call us and we can help you through that too. Is there an age limit for egg sharing is the next question. Yes, there is. You need to be under 35 years old to egg share. Okay, then there's a other series of eligibility as well that Julie Hedges can talk you through for that, because obviously we want you to be of prime medical fitness and somebody that's very likely to get enough eggs to egg share. Can we speak privately after the call? I'm sure we can, but it might need to be tomorrow, so we can arrange that. When I ask for a referral, will it be directly to you? Yes, you can ask your GP to refer directly to Complete Fertility Centre, as I said, in Southampton, Bournemouth or Portsmouth. So on the GP system, we are listed on their system for fertility. So if they have any questions about that, they can give us a ring, or you can ring us if your GP is struggling to refer to us. Do we have donors from mixed ethnicities? Yes, we do have some. Of course, though, it is specific. So do contact Julie Hedges and she'll be able to talk you through exactly, understand exactly what your requirements are. And then we can share with you what we have. Same question, what's the upper age limit for egg donation? It's 35. Can we also donate eggs separately if we're not doing IVF treatment? Yes, we would love you to do that. And please let us know about that. It's an absolutely amazing thing to offer, and it's not to be taken lightly. And obviously we would help you with counselling, etc., before you make any decision like that. But we'd love to explore that with you if you are open to that, because we're always desperately looking for egg donors. Of course, people don't walk in off the street and say, hey, I'd like to donate my eggs. It's very hard to come by people that are able and willing to do that. So please do get in touch. That's fantastic. The next question is, how many embryos are typically transferred? And the answer to that is it's one. Okay, it's very unusual for us to transfer 2 embryos because we don't want you to have twins. However, we will take your medical history into account and your age, and in some instances we might transfer 2 embryos if the embryo quality is not looking so fantastic that we think that twins are very unlikely. But we would talk to you very carefully about that firsthand. And also, because we can freeze embryos, we freeze the good quality embryos that are spare, and the freezing techniques are so good that actually the pregnancy rates with frozen embryos are as high and sometimes even better than fresh embryos. So there's really no detriment to freezing a spare embryo if you've got more than one that's suitable. There's a question saying, how many treatments does a sperm donor give, or a sperm donation give? You can have as many treatments as you wish to have or you need to have. The donor donates up to 10 families. So that means that if you had 3 children with 1 sperm donor, that would count as 1 family. And he is able to, that sperm donor can give up to 10 families. The next question is, does the offer apply to single women in the military? Obviously, if you're getting funding anyway, then you wouldn't need the offer. But if you don't have funding for treatment, then yes, of course, that offer would apply. There's a question here, is there a BMI limit? So it's a body mass limit for IUI or donor insemination. Usually our upper BMI limit is 35, but again, we'd want you to discuss that with your doctor just to make sure, you know, that's appropriate for you. There's a question, do I have to get a donor from the same ethnicity as me? No, it's your choice. It's your decision which donor you wish to use. You are given the website with all the donors. We don't ask you questions as to why or who you've chosen a donor. That's entirely up to you. In the same way as if you're going out looking for a date, you get to choose who you want to date or you know, be inseminated by, basically. It's your choice. We do not dictate that to you. Next question. I'm 39 at my next birthday and I'm single and I would like to have IVF and ICSI with a donor, and that sounds absolutely fine. That's not really, that's not so much of a question. I think that I've seen all the questions here. So I'm going to draw the evening to a close. Any further questions, we will look through all the questions in detail tomorrow, and Julie Hedges will contact all of you if you've got any outstanding questions. Our email address is info@completefertility.co.uk, so do write further questions, or if you want to make an appointment, please do email us on that, or you can call us on 02380 010 570. Really thank you for your attendance this evening, and this video will also be recorded and put up on our website under the video section, so if you've got any queries or want to go back and check what you don't remember, do have a look at the video again, and we'll be doing these again shortly as well, so keep checking our website. Thanks so much for you attending this evening. It's been I look forward to meeting you in person shortly. Take care. Good night. Bye bye.
Bye bye.